Herpes encephalitis is the only viral infection that routinely causes red blood cells in the CSF. Thanks to the hemorrhagic inflammation it creates in the temporal lobes. When a young adult comes in with fever, new seizures, and confusion, and their MRI lights up in the temporal lobe, you should think of HSV. The CSF will show lymphocytes, red blood cells, and normal glucose. If you miss it, then you'll miss your chance at starting the life-saving acyclovir. So HSV means hemorrhagic CSF, and that means red cells. The number one cause of sporadic fatal encephalitis in the US, Herpes Simplex Virus 1. Loves the temporal lobes, leads to seizure, confusion, and bizarre behavior, and you're going to have erythrocytes from the bleeding in the brain tissues. On MRI, you could see some edema in the temporal lobes. CSF, this is important, you'll have normal glucose, elevated protein, high mortality if untreated. Got to give them acyclovir. Lymphocytes and erythrocytes are going to be increased, and erythrocytes is unique to HSV. Here's our practice question. 20-year-old student, fever, confusion, tonic, clonic seizure, swelling in the right temporal lobe. What CSF finding is most likely? Well, elevated erythrocytes, normal glucose, mildly elevated protein, going to be herpes encephalitis. The temporal lobe involvement gives it away. Bacterial meningitis, you'd have increased proteins, no red blood cells. You'd also see neutrophils and decreased glucose because the bacteria is going to be eating it up. Fungal and TB also decreased glucose. Of course, the temporal findings are not going to be seen with that one. Guillain-Barré, high protein, normal cells. Also, you're not going to have encephalopathy there. So just think of the temporal lobe and red blood cell presence, the erythrocytes unique to HSV encephalitis. If this is helpful, then like and subscribe. We'll see you guys in the next video.